savings and investment. Basically, right now, we are here at this level of, at this real interest rate and at this level of savings and investment. But with an increase in savings, we're at this level with a new equilibrium with greater savings and investment and a lower real interest rate. So let's refer to a second graph that we prepared. This is the aggregate demand, aggregate supply graph. On the y-axis, we have the level of inflation or price level, and on the x-axis, we have output. So for a long time, we've been functioning on this level of inflation, which is low. If we look at March's CPI index, it's actually it's really low inflation, which is bad for our economy right now because it's harder for the federal government to adjust for monetary policy. And we're also in a recessionary gap for a long time since the housing bubble burst. So right now we're at this equilibrium, low inflation, recessionary gap. But as you can see, the aggregate demand shifts up because of a lower real interest rate. It shifts up to a higher level of inflation and greater output. But it's interesting to note that your long-run aggregate supply, which is potential output, it increases as well because with this new healthcare reform bill, potential output increases because employees are no longer locked into their jobs because they have to worry about whether their coverage will be canceled if they quit. So now employees will be free to work at a job they're better at, working at a job they're more interested in. So this will increase your average labor productivity, so increasing long-run aggregate supply. So now we have a higher inflation at this input, which is good because according to March's CPI, we have low inflation. This brings it back up. This brings us out of the recessionary gap. So overall, of course, we're going to have to make some sacrifices for the economy. Individual sectors might be harmed, such as hospitals, such as those in the higher income brackets. But overall, it's going to take us out of the recessionary gap, and this is good for the economy overall.
So now it's time for our closing statement. What I'd like to start off with is just that the con side has been arguing about all the costs that healthcare reform will bring about. But when have we ever shopped for something and only worried about the cost? What about all the benefits that this healthcare reform will bring? Like ensuring all the uninsured, lowering the price of healthcare in our economy, and creating a more streamlined and efficient system.
As Jonathan mentioned about a more efficient system, I would also like to remind our audiences that insurance is giving hope to those without it. And so with this offer of health insurance to people in America, we are giving them hope. And we should not stress over financial losses or even financial gains, but look at the most important aspect of this healthcare reform bill, which is to provide Americans with a safer future, with a brighter future for generations to come.
Most of what we presented today were statistics and cold facts, but it's important to note that healthcare reform, it isn't just statistics, it isn't just facts, it's a personal issue. It's a personal issue for many Americans every single day. It's a personal issue for the family who has to choose between buying groceries and paying for healthcare reform. It's a personal issue for the father who cannot afford to buy glasses for his 8-year-old child. And it's a personal issue for a gentleman in Michigan whose wife has been bedridden for 18 years, and he's afraid of losing his house because he cannot pay for his healthcare reform, his healthcare insurance. And with the passage of this legislation, this bill, it aims to address these problems. And overall, everybody can benefit from this bill.
First off, I would like to borrow a phrase that my fellow intern Amy once said. This healthcare reform is burning a hole in a hole that's already burnt. Right now, we are already in a deficit, and we are trying to pull out even more money from who knows where to cover all Americans. First of all, we know right now how much the costs are going to be for the healthcare reform. However, we don't know exactly how much we are going to save. And even if we do save money, that's in the future. How do we know that the current cost is not going to cost us more and get us into a deeper hole, and that that we can get in the future will be able to bring us out.
And as for the subsidies that were mentioned, subsidies that would be given back to companies, it's still a fee and it's still a fine for companies. And in addition, the $940 billion, though it may not go to waste, it's still at a time and in a nation where we are still in deficit.
Now, the opposition side, first point that Daniel mentioned, he said that this new healthcare reform is going to offer tens and millions of customers to pharmaceutical companies. However, these tens of millions of customers will be buying from these pharmaceutical companies, which will, in addition, be taxed even more. So this pretty much just cancels out the benefits to these pharmaceutical companies because of all these new taxes. Our colleague Chris also mentioned that this will result in more savings. Well, it is true. There's going to be more savings. But does that mean that companies are actually going to take those loans from those banks? Maybe not, because all these companies are now faced with new taxes and new fees because of the new healthcare reform. Larger companies will be fined instead of being given subsidies. So therefore, smaller companies will have no incentive to expand because they will simply rely on governmental subsidies for healthcare reform. The opposition team also mentioned of the bad healthcare that's currently available in the United States. But in fact, as we move towards more towards universal healthcare, we have seen many examples in the past in which universal healthcare is not as good as the current U.S. healthcare. As you can see here, the U.S. currently still ranks in the top 25 countries on the Healthy Life Expectancy Index. In addition, Americans have lower cancer mortality rates than those with universal healthcare. As we can see here, our healthcare reform will not do much more than create more problems and more expenses for the United States, which is already in a recession. Thank you.
Yeah.